How is nocturnal hypoxemia diagnosed? Have you ever wondered how doctors figure out if someone has nocturnal hypoxemia? This condition, marked by low blood oxygen levels during sleep, is diagnosed through a series of tests that monitor breathing and oxygen levels overnight. Let's break down the methods used to identify this issue. The most common and thorough method is called polysomnography. This overnight sleep study records various body functions while you sleep. It tracks brain activity, muscle movements, heart rate, breathing patterns, and oxygen saturation levels. By capturing these details, doctors can see if there are episodes of apnea, which are complete pauses in breathing, or hypopnea, which are partial reductions in breathing. This test also shows how these breathing events impact oxygen levels throughout the night. Polysomnography not only helps diagnose sleep apnea but also reveals the severity of nocturnal hypoxemia. It provides a detailed view of how well you sleep and how your body functions during different sleep stages, such as rapid eye movement sleep and non-rapid eye movement sleep. Another method used is overnight pulse oximetry. This is a simpler and portable test that measures blood oxygen saturation while you sleep. It involves wearing a small device on your finger that continuously tracks oxygen levels. If it detects drops in saturation, it indicates hypoxemia. While this test is less detailed than polysomnography, it is useful for initial screenings or monitoring known cases. In some situations, doctors may also perform pulmonary function tests. These tests assess lung capacity and function, helping to identify any underlying respiratory issues that might contribute to nocturnal hypoxemia. Imaging studies, like chest X-rays or computed tomography scans, can be used to find structural problems in the lungs or heart that affect oxygen exchange. For more precise measurements, an arterial blood gas test can be done. This test directly measures oxygen and carbon dioxide levels in the blood, but it is not commonly used for routine diagnosis of nocturnal hypoxemia. When interpreting the results, doctors look at specific indices. The Apnea-Hypopnea Index counts how many breathing interruptions occur per hour of sleep. The Oxygen Desaturation Index measures how often oxygen levels drop during sleep. These metrics help quantify the severity of sleep apnea and nocturnal hypoxemia. Diagnosing nocturnal hypoxemia is important because low oxygen levels during sleep can lead to various health issues. Identifying hypoxemia helps guide treatment options, such as continuous positive airway pressure therapy or supplemental oxygen, to improve oxygen levels and overall sleep quality. In summary, nocturnal hypoxemia is diagnosed through overnight monitoring techniques, mainly polysomnography and pulse oximetry, along with lung function tests and imaging when necessary. These methods help doctors understand how oxygen levels fluctuate during sleep, especially in those with obstructive sleep apnea, allowing for targeted treatment to improve health outcomes.